welcome everyone. My name is Dèsa. I am AMCD Professional Development Chair. Today I am joined by my amazing colleagues, Arianna and Tanu, and we are talking about courageous conversations around mental health policy and legislation. So it's 6 o'clock here in the mountains, so we are just going to kind of get started. I'm sure people will jump in, but we kind of have a lot to cover, and we just want to make sure that we will have a general open discussion about some things and what you're experiencing as well. So to kind of kick us off, it is a reminder that we are recording these, so if you're not comfortable having your video shown or speaking on video, you're more than welcome to type in questions in the chat box. We'll be monitoring the chat box and kind of answer your questions as we go along. There may be questions we save till the end, and it's just because we probably are going to cover that question. So that's just like an overall idea of that. If you're joining us today for CEUs, we are not offering CEUs for this session. So please stay because we'd love to have you, but an overall idea that CEUs are not offered for this one, but we do have 8 more webinars coming for the rest of the year that will have CEUs as well. And we're just going to jump in. So again, some just general objectives. We really wanted to cover knowledge, advocacy, and action for this webinar. It gives us an opportunity to really talk about some things you should know overall about what's happening at the state and national level. So we did cover both, but then also how do you advocate in those spaces? And then how do you take action? So a call to action overall. Our goal was to offer both because there's a lot happening and we know that people are very busy. So we wanted to break it down by general topics and let you decide what your comfort level was in terms of when you were ready to take action, you would have the knowledge, but then you could advocate for yourself in the ways you felt necessary.
Hey everybody. I'm going to go ahead and introduce myself since my slide is up. My name is Tanu. I'm a doctoral student currently at the University of New Mexico with Arianna and Dèsa. And some of my research focuses on the intersection of technology and mental health and identity development among college students, and particularly college students of color. Yeah, and I do have some experience working with college-age population, and that's what I'm currently doing as well, and that's my jam.
Hey everybody, my name is Arianna, and I'm really excited to be here with you today, and Dèsa and me as well. Such great colleagues. Issues of policy, knowledge, and advocacy and action really became important to me early on in my career, and I'll tell you a bit more about that later on. And I believe the issues that we're talking about today are really applicable to everybody, especially those of us who are in service fields. So I'm excited to talk about how important that is for social justice as well.
Thank you. So greetings everyone. My name is Dèsa. Hold on one minute. We're gonna mute y'all as we go, just so there's a little less background noise. So my name is Dèsa, and I am also a doctoral student at University of New Mexico as well. What is happening?
It is a technical difficulties day. You were right.
Okay. That's me. I have been a member of AMCD since my master's program in 2013, and just been doing work overall as a clinician, but also as an advocate on a college campus with predominantly African-American communities. And so I do work at the state and national level, both at ACA, but then also with our Black Therapists New Mexico network, where we provide services for Black communities throughout the state of New Mexico. Okay.
Awesome. So I'm going to get us started by talking about kind of local regulations and licensing. And really I'm going to start by sharing how understanding policy and staying connected to legislative issues became important to me, which was during my master's program as I was graduating. We were told to drive the hour up to Santa Fe to turn in our paperwork for licensure. And I realized that that was going to be an issue for a lot of people because New Mexico is a rural state. And my program was only an hour by car, but several other places in the state are 4 to 6 hours drive. And so the main reason this is an issue is that the licensing board was prioritizing those applications that were hand delivered. So other people in the state who didn't have access to get to Santa Fe, which is the capital, had delayed processing of their applications, which could really affect getting jobs and several other things as well. So that's definitely an equity issue, and you know, thinking about disparities and the lack of service providers in our state, it was really important to me to start figuring out ways that we could recruit and retain counselors in rural areas and support people who choose to live in different parts of the state. And I know Tanu has a bit of a story as well around just getting licensure here.
Yeah, I can go ahead and jump in and share. I moved to New Mexico from New York, and so I was fully licensed already in the state of New York, and it took me a little bit over a year to get everything sorted out. And again, I ran into a lot of issues because I just didn't want to drive to Santa Fe, and I wanted to mail it, and I didn't, you know, I was used to that coming from New York, so just the adjustment, first of all, took a little while, and I didn't understand the nuances of transferring a license across states, which, you know, those are the things you do not learn in your program. Those are the things that you learn while you're doing them oftentimes. So it was an issue. It has been resolved. I am also licensed in New Mexico now. However, just the time that it took and the back and forth and just how starkly different even information on websites that's provided through the state boards is, all of these pieces play a huge part into accessing information and then being able to use that information.
Yeah, definitely. And I think about like, as well for you, there's definitely like that privilege and safety being in a doctoral program and being able to continue with your practicum work and those kind of things through the safety net of the school. And so people who move here from out of state, you know, with maybe even a job lined up, to have that like set back 2, 3, 4, maybe even 6 months can be really problematic. Another issue that happened with our board here has been an ongoing process is our rules and regulations state that supervisors needed 3 years of training and experience prior to initiating a role as a supervisor. And that wasn't clear if that meant training prior to being licensed, training when you are in a non-independent licensure, or starting independent licensure. And it had been interpreted several different ways. And so some people were getting approved to be supervisors and they were keeping a list of those people. And then other people were being turned away as supervisors. And so again, that like limiting the trajectory of our career as counselors and trying to keep up with other fields as well, like psychology and social work, which don't have those same kind of rules in place. And so in a state like New Mexico, where you have to have non-independent licensure for a minimum of 2 years, and then if you had to be independently licensed for 3 years, that's 5 years to get to a midpoint in your career, and that can really affect these things. And so learning how to like go to board meetings and access the board meeting notes, and if you can't get to board meetings, but even just advocating through your board and letting them know what's going on as counselors on the ground, because if they don't have that feedback, they're not going to be making changes that support that. So that's definitely a big thing on licensing and regulations. And then moving kind of toward local and state data, I think that this is one thing that is really important and can really help communicate with legislators and other people as well. But knowing more about your community health issues and understanding disparities really helps to know where to put efforts. And so we hear that on the ground ground experiences as counselors, and then as students as well, through research in those different pieces. So knowing kind of some of these different health issues are really important, and a powerful way to advocate for clients, because you're moving kind of beyond client stories into how this is impacting the community at a systems level. So there's a bunch of different things that you can do here, like exploring the Robert Wood Johnson Health County rankings, which provide information on a variety of factors, including health outcomes and health behaviors such as smoking, physical activity, access to exercise opportunities, alcohol-related deaths, sexually transmitted diseases. So, these are all linked to risk factors for depression and risky behaviors and those kind of things. So they apply in clinical and counselor educator work as well as to creating like change in your community through advocacy. Let's see. Another example, I think, is around the last several years. There have been a lot of bills and legislative initiatives around missing and murdered Indigenous women and girls. And there was a Indigenous Women's Day at the New Mexico State Capitol. And this was posted on Facebook and sent out through email blasts and several other factors. So staying connected that way can really help you be informed about other things that are going on. And so this year they were focusing on missing and murdered Indigenous women and girls at the Indigenous Women's Day at the Capitol. And again, connecting that to data, there's a recent study out of, I believe, Seattle, that found that New Mexico was one of the top 10 states for the highest number of cases of missing, murdered Indigenous women and girls, as well as Washington, Arizona, Alaska, Montana, California, I think Oklahoma, Minnesota, Utah, and Nebraska. So if those are any of your states, I definitely encourage you to look into the data around that, because it definitely needs advocacy and momentum for support. And some of the issues around that are data is not really collected on that. So in New Mexico, there were some some cities that said that they weren't able to pull deaths or missing people by race ethnicity from their databases. And that is really a limitation to knowing how big a problem is in the community. And that's certainly an issue in Black Lives Matter movement as well. So thinking about all of these kind of different pieces around data can be helpful for communicating with legislators as well. And then moving on to the next slide of state legislation. The other thing that is really cool, and this is a nice transition into talking a bit more about connecting through social media and things, the New Mexico website for their legislative session has an entire calendar that lists all of the different bills that they have, lists different days that are going on. You can actually stream live webcast what's going on in the House and Senate floors. So even if you can't be there in person, if there's an issue that's really important to you, you can see what's going on in the room. So I would really encourage you to stay connected that way as well. And those are resources that I think sometimes we forget to even look for. So opening this up to conversation a bit, what have your experiences been with your local licensing board and state legislature, and we'll just start there.
So to give, we decided to put questions throughout just to make it a little bit more collaborative, but to give people opportunity to participate in the discussion as well. And so for me, I got my master's here at New Mexico State University. So when it was time for me to apply for licensure, I had a very easy time. It only took me, I think, 90 days to get temporary licensed. And then I think only another 45-ish days after I tested for my NCE for me to get my LMHC. Though some other states have several points in terms of testing. So like, I just had to take the NCE, and then for independent licensure, we have to take the second one. I can't remember the letters, the NMHC, whatever.
The National Clinical Mental Health Counseling Examination.
That one. But that's also a discussion that we talk about in terms of supervision as well when we're talking to students coming into programs. I think it's important to highlight for them to know just overall information for students traveling to go to school in other states, because if we don't give them that information, it can be a little daunting, but also very expensive, like an unrelated cost to the program that people may not know. So for me, it was seamless, but I am from the state, and so they knew my institution, right? So it would have been a completely different conversation if I had transferred to a different state for my PhD. Any other thoughts? Okay.
So we can talk a bit about, if anybody wants to share what inequities you're concerned about in your community. I think you can send a chat or unmute yourself and share a comment as well.
Okay, then we'll keep going.
And then we can talk a little bit about avenues that you have or focus on to address or advocate for issues in your community. I think I shared a bit about that for how I've connected with the board in trying to advocate for people to have access to licensure in more seamless ways as well. But Dèsa, do you have any thoughts on things that you've done or could do to address?
Yeah, so one way that Tania and I have both advocated in a different way is we started a similar conversation at our New Mexico Counseling Association conference around legislation and inviting legislatures to come talk to the counselors during that conference. But other things I've done personally is in New Mexico, we started the Black Mental Health New Mexico Network. And so it's a place for all therapists. So it's social workers, psychologists, and family therapists, as well as counselors, where we come together once a month and we talk about issues happening statewide. And that is also broadcasted to other towns as well. And we, in a sense, put a monthly report together that we then present to the governor and to the African American Affairs Office. So there's been some different avenues for us to advocate for African Americans within the state of New Mexico. But I think the hard part is it's good for me to do that work because I think people need to see therapists that are Black like me in our state, but it also means that that same mechanism may not be happening in Latinx community or in our Indigenous community. So we're making strides in certain areas, but a reminder that sometimes it feels like a little bit like an island, that like we're trying to get services for just one group of people and not necessarily everyone. Yeah.
Yeah, and I can speak to a little bit more of a micro sort of level of advocacy because I do work with students pretty closely, fairly regularly. So through supervision, I've tried to provide as much information on if folks are interested in moving. And this, again, ties to my own experience with having to do that. So that's my little bit of what I've been focusing on lately.
Yeah, absolutely. Okay.
Awesome.
So moving on to social media. And this is something Arianna had mentioned as she was speaking about Black Lives Matter movement. So this is one other avenue for folks to get more information and understand what's actually happening in your local community is through social media. And I do understand that people have very varying degrees of engagement with social media, and people have very different ideas of what that looks like for themselves. So I just have some questions. So if you are involved on social media, what does that look like for you currently? So as you saw on my introduction slide, I do have a website. I do have a professional Instagram, and that's open access. And I'm very careful with what goes on to those places because, again, as we know, the internet, from what we know now, is forever. So. And Black Lives Matter as a hashtag movement as well. And it makes me think of the Me Too movement. And there's been a lot of advocacy from the millennial population, and not just the millennial population, but there's been a push for that to become a larger federal concern. And a lot of those did start on social media. So it is very powerful and it is a very useful tool to have. Anybody else have any professional social media accounts? Do you use them?
So I use my social media every day. Mine is a professional account, but it's not just mental health. I tend to have my Instagram account is more geared towards my overall life and different aspects of my life as a student, as an athlete, but then also as a counselor. And that has allowed me to show balance to in a mentoring mechanism. So making sure that people know that I'm not just a counselor, that I have a well-balanced, well, I would like to believe it's well-balanced, but life. So that has been different for me versus I do have a Twitter, but I feel like Twitter has become a lot more hip since our recent president. So I think people are using more and more social media platforms, but I think it's still scary because they do last forever. We've also seen lots of mistakes made through social media as well.
Yes, and that was going to be my next bullet point to speak on, is as engaged as I like to be and want to be online and be where the real life is right now, there are boundaries because that information, again, stays there forever. So there is a professional boundary, there is a personal boundary, and there is a big gray area as well. So how do you navigate that for yourself? And for myself, I keep my Facebook page private. It's only for my private life with my family and friends. And in order to counter that, I have a professional Instagram so that I'm still present. And I do follow ACA, I follow ACEs, I follow AMCD page just to know what's happening in our associations as well. And I also follow a lot of local New Mexico pages as well as New York, because that is still home for me, just to see what's happening in the community and how I can support the best that I can right now. And that's, for me, one of the ways to stay connected.
Yeah, I think for me, one of the boundaries that I really set when I did become a counselor was make all of my accounts private, and they are primarily for connecting personally, and then engaging in social media, mainly through Instagram, in ways that are more professional. What I like about that is I can also keep my posting to a minimum, but engage a lot with what else is going on, so I can stay in touch with what's going on through our different networks. So that's been a strategy that I've used to kind of create boundaries and separate those pieces.
Yeah, and I think something that I've realized as I've gotten to know a lot more people in academia is it's also important to know your university's policy on social media. So if you are tenured faculty or faculty track or have a contract with the university, being aware of what that policy is as well, just because I feel like we should be independent people, but ultimately you end up representing the university in some way. And you don't want that to affect or be affected when you're posting on social media, especially around politics.
Yeah, definitely.
Absolutely. Would anybody like to share their level of involvement with social media?
Okay.
Is anybody following their state associations or politicians? Because as we know, that's where they are as well. And they post all of their stands on social media as well. So it's a really great platform to understand, one, who's currently in office and what issues they're taking as priority, and two, who is interested in being in office, because that is the next thing.
Mm-hmm.
And has anybody used social media for advocacy and leadership purposes?
I think something that, and I'm not sure if she's on this call today, but Dr. Dickerson, she has a podcast. And so I've seen her post stuff on her social media about her podcast. I think her podcast even has a social media platform. So I think that people are advocating in different ways, I guess I would say, is that it's not necessarily connected to maybe your personal brand, but it's like an offshoot of something you're currently doing. So really making a stance in a different way, I think, has been impactful. But I think the hardest thing about social media is also how do you balance all of that with all of our other responsibilities while also navigating the constant stream of updates that come out of social media, especially Twitter. I feel like things are happening so rapidly and so quickly that it's hard. It's almost like it's old news by the time that you hear about something you think is new.
Mm-hmm.
Yeah.
Like, you know what I mean?
Yeah, definitely. I think that that's very true. I think that it's important too, though, to stay connected to movements that you're passionate about, and social media really provides that. And so, I mean, I think that that's something that I do because I have a little bit less of a social media presence than I know the two of you do. But right, it's like following those movements and then being able to show up and support causes that are really important to me or advocate for them when I am in settings where I'm able to. And like continuing that relationship even if my presence isn't as big.
Yeah, exactly. And I just want to highlight one other thing that we do not have on our slides is to really, especially for those who are working with clients currently, that social media is having a really large impact on people, especially the information that's there. I mean, as Dèsa and Arianna both said, there's so much information coming at you at all times that it can be so overwhelming. And especially if it's concerning something that's really close to home for somebody, either yourself or either a student that you're working with or a client that you may be working with. And just knowing that those things are very real and very present for people, and they can be extremely stressful.
Yeah, I'm glad you brought that up because that's a big piece of like why I stepped away from social media when I became a counselor, was a big piece of self-care, and not to disengage with it fully, but to kind of monitor my relationship with it so that it wasn't taking over my life or causing me more stress than it needed to. And so having set times to like check social media accounts for me was a really helpful strategy. So it wasn't just my phone blowing up all day long with all of these different notifications that this is what's going on today. And that's a way that's really helped me to feel like I'm in control of that relationship a little bit more.
Yeah, exactly. And there's apps for that too.
I feel like there's an app for everything.
Does anybody want to share any last thoughts on social media?
I guess I can bring up one thing that I know has become a critical issue, especially for counselor educators, is some of the policies that higher educational institutions are bringing forth about faculty and their social media accounts and the presence that we have in regarding who we're, what groups are we joining, what are we posting, in what ways are we advocating. And I think that's, you know, that's something that's very real and happening right now. It's happening within our classrooms. And it's something that I think is bringing us to a point where you might see some disengagement as a result of that, and also needing some advocacy on that front. And what does that look like? Where, you know, higher ed institutions, which are supposed to be areas for critical discourse and conscious engagement, we're starting to be limited in that. And especially in the field of counseling, you know, that can be really critical, because we're supposed to be areas and spaces where we are allowed to engage in those discussions and advocate. So just wanted to add that perspective.
Yeah, I think that's a really, really good point, because it's, I think it's, I have a lot of students who are strong advocates and ready to like do everything possible to take that lead. And I think it's important for me to support that avenue, but also I don't have that same luxury, right? So I'm not an undergrad. So it's still, how do you give good mentorship around pushing forward and making social change, but in a way that doesn't necessarily hurt your future? And I think that's something we still need to figure out with social media.
Yeah, I think right now it's a very difficult balancing act.
Yeah. Thank you for sharing.
Yeah, definitely.
Okay, so I'm going to talk a little bit more about things you should know for the Senate and House representatives. So it's important for you to get to know who your senators and representatives are, realizing that these are people elected by you, and they all have local offices and they have local correspondence as well. So even if they are at the time in DC themselves, their local offices are open and they have staff there. So there's always an opportunity to kind of learn who they are, letting them know what you appreciate as much as you let them know what you do not like as well. But then also we provided a link so you could kind of figure out who your representatives are as a whole. It's interesting in that every state has a House and Senate as well, but realizing that local issues are often very different than national issues, and there's kind of a lot to cover, but like Arianna mentioned, you can go on your state website and get a real good idea of what's happening during your legislation, but then also the same holds true for the national level as well. So if you do have opportunities, asking your House representative to speak for you and your state, but also realizing that you, in a sense, voted for them. And so they're using your vote in a way to get stuff done on Capitol Hill. But when you're thinking about ways to gather this information, I think social media is a perfect opportunity to get multiple perspectives, but also remembering that you want to gather data from multiple data points. So whether it's the news or the newspaper or different websites, different outlets will report on different things. And so to get an overall well-rounded view of maybe what your senator or your representative is doing, you want to check with different things and points of time going on, especially as you get closer and closer to elections. So we know that during all election periods, there's a lot of ads and a lot of things kind of coming at you from different perspectives. I tend to stay away from those things and really focus on what their website is saying, what agencies that I support are saying. So what is your state counseling association saying? If ACA or ACEs or AMCD has an opinion on a topic, what are they saying, right? So you're in a sense paying for these associations to also speak on counseling issues, but also multicultural counseling issues when it comes to AMCD as well. And then realizing that currently the presidential election is actually November 3rd of 2020. So we're really in an early stage of a very long process, and remembering to pace yourself. So in the slide, I included all of the people who have announced that they're running for president as of 2 days ago. But that list is actively changing. More and more people are saying that they are running for president, but we really won't know the concrete list of who will be up for the caucus until I think August or September. So realizing that everyone and their like cousin is running for president right now. So how do you balance that, and knowing that in the long game, a lot of the people who have announced will most likely drop out. So if you have opinions around people currently running, knowing what those opinions are and looking into them as possible candidates, but knowing that that research is going to occur over the next like year and a half almost. So it's a really long process, and we won't really know until we get closer. So some things I really wanted to touch on is more implications for practice and supervision. So out of ACE's best practices out of 2011, really recognizing as a supervisor that multicultural supervision is infused with multicultural considerations into his or her approach to supervision. So really thinking about how you're having conversations around politics, policy, and mental health in your state, but also in the national level. But then also realizing according to our multicultural competencies, multicultural and social justice counseling competencies, that we really need to gain understanding of how we advocate for individual counseling and systems for both privileged and marginalized clients. So I think that the Black Lives Matter is a perfect example of a way that we've been advocating for groups in different ways. Me Too, things that are happening in Indigenous communities as well, but also remembering that we're not just here to serve marginalized communities, we're also here to serve everyone. So how are you advocating for everyone in those spaces? Another example is something AMCD has done in collaboration with LGBT a Civic and CSJ was the licensure portability webinar, which is on the AMCD website. That conversation is going on right now in our field. So really thinking about implications to really what Tanu and Arianna spoke about in terms of getting licensed in a new state and what that process looks like. It's easy for me to be like, I went to school in New Mexico, so it's easy for me to get licensed. But realizing that at one point in time, I may leave New Mexico, so I do have opinions of licensure portability because that affects our field as a whole. And so knowing where you stand on that issue can be important in the future. Some other things to know is, like we've said earlier, there's a lot of things happening a lot of the time. So just keeping your eye out for things that apply to maybe your field of focus or things that are impacting your practice. So 2 or 3 days ago, the president just announced the National Call to Empower Veterans and a multi-billion-dollar grant in terms going to the VA to improve services for veterans and issues around suicide. And so that has been a hot topic for a very long time. So realizing how that may impact your clients or people you're working with or even their families could be really important, but also realizing that that may actually be a mechanism that supports you as a counselor in the future. So if you're working with the VA or with veterans, it may be opportunities to apply for grant funding to do some interventions yourself or different research in your area. So overall, we wanted to offer you just a few things to think about as you're moving into really taking action and how do you approach these things. So just recently, Darwin Sue released an article on micro-interventions, which really talks about how do we disarm and address microaggressions and macroaggressions in a different way. I think a lot of us as scholars are moving away from talking about what's happening to us, and instead, what are we going to do about what's happening to us? So overall, some main themes was make the invisible visible, disarm the microaggression, macroaggression, educate the offender, and seek external intervention. So I highly recommend that paper as an overall idea of what allies as well as bystanders can do, but then also how do you get started as a counselor educator, but also as a supervisor as well. And then because we are AMCD, but also we want to be in line with the multicultural social justice competencies, I wanted to briefly talk about repairing cultural ruptures. So in a lot of times we have conversations about policy or mental health from a place of personal experience, which I think is very valid for everyone speaking on that, but realizing that some of those conversations can bring up a lot for people and can often cause some kind of cultural rupture, either in your supervision relationship or relationships with students or friends or family, and thinking about how you address repairing that. So really dealing with defensiveness, cultivating an environment in which the supervisee can disclose cultural ruptures. So really providing a space for people to talk through what has happened and why they had the feelings that they currently have around that. But then also getting feedback about those ruptures. We don't want to move forward in a space assuming that things are okay if we don't really address it culturally, but also from a culturally humble perspective. So we wanted to continue the trend and really talk about where do you start. So we want you to start where you are and use what you have and really do what you can. So taking all of this knowledge you have that we have addressed and figure out the best way to use it for your own advocacy efforts and how do you implement it that best fits you and your practice. So one thing we did want to give you again was the website to talk to your legislators. So find my legislator. The best way is just to throw it in Google and it will bring up where you currently are, and it will even provide pictures where they live. All of that information is on the internet and it's an open source. So you can get that information and contact them as soon as possible. You can do this through any government website. You can also see state legislators as well, but something that can be important to you in terms of how you vote for them or how you talk to them is you can see what bills they have sponsored and what committees they have access to or what they serve on. So here in New Mexico and most states, as well as Congress, has a mental health committee, and so people serve on that committee to talk about mental issues. So it's important for me to know who's on that committee so I can talk to them about what's going on or I can suggest changes. If you are passionate about an issue, asking your legislator directly on where they stand. So not necessarily following their website or following what they're saying on social media, but going to maybe a town hall and really addressing this issue with them directly. Remembering that you want to touch base with your city level, but also your state level is important as well. So some, like our counseling board, a lot of those decisions are going to be made at the state level and not necessarily in your city. So like Arianna said earlier, it's difficult for rural states like New Mexico where the capital is 6 hours away, but realizing that may be something you want to do if you really want to get heard in a different way. And this serves the same as the DC level as well, realizing that they are in DC, but they do come back to your state because they do have a home and an office here. So you could always stop in and have conversations with them locally and reach out to their correspondents. Tania, did you want to talk a little more about social media?
Yeah, and that's just one other platform. Most legislators are on social media to some degree and have their information there as well. So that's, like I said before, that's another avenue to be informed by. And again, based on what your comfort level is with social media, it is possible, like Arianna mentioned, to be informed and be connected, and at the same time not have to divulge your entire life either. So, you know, and another great way is listservs. Listservs, oftentimes, whether you do the digest or the daily, will present information on what's going on currently in your state, your county, your city, federally, whatever, you know, you want to be focused on. And yeah, exactly. Mm-hmm.
Yeah, I'm glad you talked about digest version, because I am on the SESNET digest version, because it's an overwhelming listserv for me. But I think it's a way to stay engaged and connected without being on the daily feedback in a way. So I encourage all of you to be engaged in some way, but choose the best comfort level for you. You don't necessarily have to be in the front and center of it.
Yeah, definitely. And I think too, like experiences with the board here in New Mexico, like you can send in letters and they'll read them at the board meeting if you can't make it. You can look at the meeting minutes and agendas to be connected in that way. And there are lots of other listservs and community websites that operate that way as well, so that you can stay connected. So lots of opportunities to connect in the way that works for you.
Yeah, and like Arianna said, with the letters, it just reminded me there's even apps that'll write letters for you that you can sign up for, so that it saves time, and you know, you can select which issues are the most important and prominent for you, and it's just a couple of clicks, and it's pretty easy to do that now.
So as I said earlier, we want you also to acknowledge the things that you think your legislator is doing well. I think there's been a lot of discourse around all of the many things they're doing wrong. And I think that's very accurate. If you feel like your legislator is not doing anything right, then I think you should let them know that. But also giving feedback to legislators who are doing a good job, I think is important as well, so that they get some feedback of things you're excited to see. But then overall, they know that you're supporting them and that they're supporting what you believe in as well. And then lastly, we really want to talk about like not getting discouraged. The process might at times be very long, but any progress is better than nothing at all. So again, realizing that you all have multiple identities and you're all doing multiple things in your lives, and advocacy is a huge part of all of those things in different ways, but really defining for yourself the kind of advocacy that supports you in your career, in your space, but also things that are really sustainable and kind of long term. So keep working, keep trying, keep building your network of supporters, and then realizing that overall your opinion really does matter. Arianna, do you want to address the last slide?
Sure. So we just wanted to kind of sum up some different things that we talked about today as reminders. So definitely focusing on continuing those, I mean, Dèsa was just talking about this, but continuing your efforts, but having it be sustainable. And since, you know, I think a good example of that is our presidential election, and we're already talking about all of the people who are going to run, and yet that election is not for quite a while. And so how do you pace yourself and just make sure that you're taking care of you during that time? Knowing your own boundaries and limitations. I think the three of us actually provide like a good example of that, because we're at different spectrums of how to engage with social media and what level we engage in it at, and how public we are with our personal or professional life. And so it's really about finding what works for you, but also connecting in so that you can advocate in small and large ways. So let's see, making sure that you connect with power in numbers, connecting and reaching out to your associations and other colleagues and friends to start having difficult conversations with them. I think that the micro interventions is such a great starting place to open up conversation, especially if you have students or anything as well. You can like share that article and just start a conversation. How could we implement this together kind of talks. And so those are great places to start. And then lastly, using social media as a resource, and using your best judgment about, you know, what goes on there and how it stays on there for a long time and can follow you across your career. What am I missing?
No, that was great. Yeah. So overall, we wanted to open up for people if they do have questions or feedback or examples or things that resonated with them. We would love for you to share what you have or experiences you've had just overall, so we could get some feedback on how you're addressing these issues in your own practices.
Or even if you have any questions for any of us.
All right, well, we are not going to hold y'all if you don't have any questions. We appreciate you taking the time to join us. We 100% understand that this is a very long process, and I will email out the PowerPoint to everyone who's registered. Again, we really hope that if you do have questions for us one-on-one or things you need to talk through, that you reach out to us, but also reach out to AMCD as a whole. This webinar again was offered by the AMCD Professional Development Committee. If you have people who wanted to be here but couldn't attend and they are members of AMCD, the webinar will be available via our website. So again, we hope that you have a wonderful night, and we will talk to you guys soon.
Thank you all for being here.
Thank you.